I feel like I've taken the strongest muscle relaxant in the world, and I feel like I've taken 10 of them.
That much less.
That much relief.
I could just definitely feel this subtle freeing. It's just like, as if the way now I see it, it just feels so normal, but I absolutely felt that contrast of bit of tightness to full movement.
Meet Joan Harold. This mother of 2 young children had her tongue tie released as an adult. Here you can see her tongue following the procedure, and although it might look painful, Joan says it was a positive experience.
The tongue, from a very structural point of view, the tongue received a lot more space at the back, my jaw could drop, and it was interesting because my tongue was quite numb but I could feel it in my mouth doing all the things it needed to do that it had never done before, so it was really interesting.
A tongue tie occurs when a piece of skin called a frenulum ties the tongue to the floor of the mouth. You can see on the left Joan's tongue prior to the release and how much freer it is following the procedure in the image on the right. Joan now works as a craniosacral therapist. Previously, she'd been a speech and language therapist for 17 years. Her tongue tie never caused any difficulties with speech. Instead, it was other recurring issues that motivated her to get her tongue released.
I had TMJ, I had consistently sore neck, I had, in my early years, I'd had a lot of migraines. I'm not sure that they were related, but, possibly around teeth grinding. I was grinding my teeth at night, particularly on the right-hand side, and I would have had a lot of neck pain.
On the right, you can see the TMJ or jaw joint Joan referred to. This joint, located in front of your ear, helps us all to eat, talk and yawn. When jaw joints are misaligned, someone like Joan may grind their teeth. This grinding motion can wear away the cartilage in the jaw joint over time, leaving just bone, which can result in serious pain. Joan, who's based in the beautiful surrounds of the Burn in County Clare, says there has been an improvement in this pain following her release procedure.
The neck and the TMJ, I don't have, my jaw used to click a lot. I don't have that anymore at all. And what I would say to anyone looking for something to be resolved through their tongue tie, read about it, go on the internet. There's a lot of really positive stories out there. And there's the donkey.
He agrees. Imagine you were just going about your day, walking along enjoying the sights, and suddenly this happened. You can't see or think clearly, you're left feeling helpless. This is what it's like to experience a migraine with aura. The visual disturbance is called an aura, and this aura signals that a migraine is soon to follow. This is an experience Geraldine McNamee knows all too well. Her migraine with aura episodes became so frequent and violent that she stopped working and essentially stopped living. Mother of 2 Geraldine, who also has TMJ, says by the time she attended the dental clinic that would ultimately help her, she was in a state of despair.
They say life begins at 40 and suddenly I start getting violent migraines, and it really did take over my life. And started taking over my family's life because we were restricted in what we could do in case Mom gets a headache. I can honestly say that I went into them completely despairing for my own health because I had gone. This was literally my last stop. I had tried absolutely everything. I spent a lot of time and effort. And so it was actually kind of a relief for them to say, well, we really think this is what is causing your problems.
This photo was taken of Geraldine and her husband Bernard during those difficult 2 years. She explains what the release procedure was like for her.
I guess I was apprehensive. I am kind of squeamish, so I wasn't looking forward to it. And it was all done, I'd say within 30 seconds, 1 minute max. And I came out and it did feel sore. It did feel painful when the anaesthetic wore off. But I went straight back to Tony and Bridget and started immediately within an hour of my tongue tie, my myofunctional therapy.
The Tony and Bridget she refers to are orthodontist Dr. Tony O'Connor and her orofacial myofunctional therapist Bridget O'Connor. They run the only dental practice in Ireland that offers this unique combination of treatment, both of which Geraldine required to help her condition. Geraldine began her myofunctional therapy with Bridget following her release procedure. This therapy re-educates the oral and facial muscles to correctly posture the tongue in the roof of the mouth following a release procedure. Myofunctional therapy also improves breathing, chewing and swallowing. Bridget O'Connor explains where a tongue should sit in the mouth.
If this is a mould of the upper teeth, we know that right behind the two front teeth, there's a small little area, I've just highlighted there, called the spot. I personally call it the magic spot because when the tongue tip is actually resting on that spot, we are encouraging the release of hormones in the brain, things like serotonin, things like the feel-good hormones.
Geraldine's 2-year treatment plan has included myofunctional therapy, major orthodontic work, cranial osteopathy and medication. However, all her hard work has paid off and Geraldine's migraines have vastly improved, allowing her to return to her job as a project administrator in University College Cork. Geraldine says she's delighted to be enjoying her life once again and has a particular appreciation for the simple pleasures in life, like having fun with her family or playing with her dog Izzy.
Everybody in conversation, everyone that knew me knew that I was really having a tough time with migraine. So it was great to have a conversation that didn't revolve around my migraines actually. Yeah. So to be able to be back in part-time work, living my life as normal is just wonderful. You know I still get migraines, but it was truly worth it, and I'm very grateful. Yeah.
There's a number of methods used to perform a tongue tie release procedure. Some practitioners use a scissors or scalpel. This video shows Bridget O'Connor getting her tongue tie released with a scalpel. This method is very effective. Laser is another popular method. Here Dr. Dermot Murnan demonstrates how the laser works. You can see how it barely marks the top layer of his skin. Dr. Murnan says this method has many advantages.
There's little pain or bruising or swelling afterwards. The healing is excellent. You can get a good result with both of them, but this is a much simpler, easier method of getting a good result.
Regardless of the method of release chosen, this procedure can be transforming. Just listen to the effect the procedure had on Samantha, who was clearly emotional following her release.
Every time I stick my tongue out, I want to cry because that used to bring up this internal feeling. I can't explain it, but it's so easy now. I can move my tongue without feeling tense and tight, and I'm gonna go get a massage because I just feel all droopy and relaxed, and 40 years of tension is just now kind of melting away.
Several studies indicate that tongue tie has a genetic component. Some practitioners say that 50% of those with tongue tie are likely to have a family member who also has the condition. This is the case for the Kingston family from Bandon, County Cork.
I'm Alison, and this is my mum, Shirley.
You both have something in common besides the fact that you're mother and daughter.
Yes, recently I got my tongue tie release done
6 weeks ago, I suppose, is it?
6 weeks ago.
And I got mine done 3 weeks ago. Yeah.
Alison, who works as a food coach, says her mother Shirley didn't think much of it when she first told her she'd been diagnosed.
Yeah, I kind of thought my attitude of that was almost so what, you have tongue tie, it's not going to really hold you back. But then when I kind of went online and looked up about it and met Bridget and Tony, a whole new world opened up for me then.
Shirley says she never noticed that Alison might have a tongue tie. However, Alison remembers it holding her back a little in school.
I did find pronunciations hard.
Harder,
yeah.
Did you? Yeah.
It took me, I remember starting school and the teacher taking extra time with me to pronounce things like school properly. I was saying school, miggle.
Oh, yeah.
So there was a few I was conscious of it.
Both mother and daughter got their tongue ties released to help with the tension problems in their jaw and neck. So, has it made any difference?
I mean, Alison would have noticed a bigger difference in your jaw after the tongue tie release, in that she felt a huge release in her neck. Now I've had a lot. I've had implants done recently, and I just feel that it's going to take a little bit longer for me to feel the full impact of it. I would hope in 6 months' time that I really will notice a big difference.
Joan, Geraldine, Alison and Shirley have all had their tongue ties released as adults. But what aspects of their journey have struck them the most?
When I heard the word tongue tie, I assumed that was something that midwives checked in every single baby that was born in the land. So I don't know if I was ever checked, but when I think of all the dentists that I have been to throughout my life and nobody ever observed it about me, it's hard to believe.
And it is now compulsory in Brazil for every child. Every baby born, their tongue is checked. I mean, how sensible is that?
Dissemination of information would be really useful for the GPs and for, you know, anyone who's got consistent body pain. That, you know, that's something that I will always ask adults who come in here. Have you had a tongue tie assessment, or is there any history of tongue tie in the family?
It's a choice, you know. It does cost obviously a certain amount of money, but to me it's choices of what I spend my money on. And
Do you see it as an investment in your...
such an investment. Sure, I could continue with getting the neck pain treated maybe short term with certain therapies, and you would be spending money obviously on those treatments to manage something. So to think that I'm going to get to a root cause of pain and discomfort just makes so much sense, and absolutely investment in my health and well-being.
Here you can see Alison was literally doing cartwheels following her release procedure, something she says she would never have experienced had she not freed her tongue.